Please, I would request all the participants to mute the mic.
लकड़ियों भी वो क्या लगाते हैं।
Hello, can you hear me?
Yeah, I think it is Dr. Prashant, isn't it?
Oh, yes.
Yes, thank you, doctor. Yeah, thank you. So, welcome to another session of Forum for Medical Pluralism. So, the objective of this forum is to actually bring out important discussions and important key aspects of policy, how different medical systems can coexist, in the way how they can exchange knowledge, in the way how they can exchange experience, how the different medical systems can actually bring out common policies, common research objectives, and kind of a common platform where each other can cooperate and co-nurture also. So I think we are today happy to have our very reputed physician and a very renowned expert in especially in the domain of multiple sclerosis, Dr. Prashant Raghavan with us. And we have the session chair as Dr. Rajnikant Patil. So to just give a brief description about today's speaker, I think Dr. Prashant Raghavan has graduated from Mangalore University. Now he is currently serving as the CEO and Chief Physician of Ayush Prana, the center which is actually focusing specifically on advanced and complicated disease like multiple sclerosis. He has treated around thousands of successful cases of multiple sclerosis, and he is part of a very reputed lineage of Ayurveda and traditional system. And his work are being very well acknowledged, and his work are being very well actually reached in globally also in part of Europe and many other places. So as part of Forum for Medical Pluralism, I invite Dr. Prashant Raghavan as the speaker today. So nice to have you, sir, today. Yeah.
Thank you, Dr. Sandesh.
And we have our chair, Dr. Rajnikant Patil. He is the Chief Physician of Agnivesh Ayurveda, Surat. And he's very well known for his works in the advanced conditions and emergency condition, especially in the context of mucormycosis. He has treated thousands of cases of mucormycosis and saved many patients. And his works are being acknowledged even by the mainstream international medias like BBC, when he has actually saved a patient from Pakistan. So he's also into Ayurveda emergency care practice, and we also had his session on the first session of our medical forum for medical pluralism. So I wholeheartedly invite Dr. Rajnikant Patil as the session chair. So we don't want to wait to hear from Dr. Prashant Raghavan. So, sir, floor is for you, sir. Thank you.
Actually, you are doing a very commendable job, and so you should be the first speaker. Anyway, Thanks for the invitation. And I recently got to know that Dr. Skandesh and Dr. Abhimanyu, in fact, initially had contacted, and you were on a tour throughout the South Indian, through the certain renowned hospitals where they are managing emergency system of Ayurvedic aspect of emergency system. So it is quite interesting, the youngsters are really very much keen about bringing forth the the newer aspects of Ayurvedic medicine. While coming to my expertise or my specialty, that I was thinking in the way back in the beginning of 2000 that Ayurveda got to be, going into, or it has to go in the path of a speciality where then only it can get a stage of its own. And in one way, Ayurveda is not an alternative to allopathic system of medicine, but it is having its own platform and its own credibility owing to its basic fundamental theories. So once we once we are compact on it, and once we are searching for such solution, there is a wide vista of opportunity in front of us. So I was in 2000, soon after my course in when I completed my UG from SDM. Then prior to that, I was having quite a good experience in the medicine making and different aspects of Ayurveda, since in my family. This is being continuously practiced for 3 generations. So at that time that I was concentrating on MS, basically because of the reason that it is affecting young adults. One of the a disease that takes the major reason for a young adult to be in the wheelchair. That is how it is explained. And also, parallel to that, there is no treatment to stop or cure or reverse multiple sclerosis in the conventional system of medicine. So these are the two things what makes me to concentrate on multiple sclerosis. So then during the past years, it was really a big struggle when you start to concentrate on a very rare disease. That MS is coming under orphan disease. So 1 in 200,000 people are only affected by MS. So I was having a dilemma in the beginning stage whether to concentrate on that. By that time, I got an opportunity from Germany. So where I was moving to Germany in 2000, and there initially I started with the general practice. Then I moved on to giving different lectures in many self-help groups in Germany, as well as in the nearby countries like Switzerland, Poland, and Italy, etc. So slowly, it was difficult. It was difficult to convince them, but initially I started very slowly, but in a very concentrated way. And results starts to pour in. Like the results were really remarkable. I have to put forth one of the important aspects of my clinical practice or success of any Ayurvedic speciality or any Ayurvedic treatment. It's based on the quality of medicine. So in my family, we were also having a very, we were keen on keeping a quality on medicine. So I was, in fact, making all this medicine under my own supervision or involving myself during that time, and even up to now also, I'm very much involved in the preparation of medicine in my pharmacy. So that dedicated pharmacy and quality medicine is really, really an essential aspect of success in Ayurveda. I have the opportunity to study different medicines what are available in the market. So if you wanted to treat a chronic disease or a progressive disease, a life-threatening disease, then you need to go and prepare your own medicine because you are not getting the right quality medicine in the market. That's the first point I wanted to emphasize. That's a whole huge story behind it, and how to manage a good pharmacy, how to validate it, and how to see that you make a good quality medicine. What are the current trends in that? Where it is taking us from? What is the future of this medicine or medicine preparation? And all these things is another part of discussion. But these aspects are very well known among you, and I know that most of you prepare your own quality medicines. Then thereafter, actually in European countries, it's a very MS is well known, even though it is a very rare disease. And around 8-9 years, I got a good opportunity to treat a lot of patients in Germany. And thereafter, I started back in Kerala, in a very remote village of Kerala. But basically, my patients were from European countries. So the good part of it is what I wanted. The takeaway from that is I started with the specialty in multiple sclerosis way back in 2000, and now I can say. The third most searched keywords in Google is Ayurveda for multiple sclerosis. So this is something, when you start to make results, then automatically we are very visible. So the only thing is the initial difficulty to get into that pathway. And once you move on and consistently give some emphasis and consistently give importance to the work what you're doing, and then you are visible and you are accepted. So Aishprana's name or the treatment of multiple sclerosis in the field of Ayurveda is very well known in European countries, in US, and in elsewhere. The focus is seen, I can tell you, I was visiting a few centers there. So somehow they are not focusing on multiple sclerosis anyway. But they say that a few of the practitioners, when the MS patients are coming for Ayurveda, that they know that Ayurveda is going to help them one or the other way. It is better than the conventional medicine. So that viewpoint is there in MSP, among the MS patients. So what I wanted to tell you in this is Ayurveda doesn't say in a way to concentrate on a specialty in a broader sense, but you can take up the principle and focus without losing track of the principle. You can concentrate on a specialty, and slowly it can get what I'm saying is, if a specialty where 1 in 200,000 people are affected by MS, then other specialties are open for you. The only thing is, you have to go for it. When the logical question is that, when we have a number of diseases, and most of the time the shelf life of a medicine is not more than 6 months, and how we can be equipped then to treat, this vast array of diseases, multi-system diseases by keeping all the medicine in shelf or in stock. It's so difficult. And I think it is also high time that we have to move from treating musculoskeletal disorders. And I feel that, from our colleges or from the from the college hospitals, from our teachers, we are getting only a very restricted knowledge about Ayurveda. And I'm happy that I am, I'm born in a family that trustfully practices Ayurveda. And my father, I have to mention his name. He's an allopathic doctor also, but he's so convinced in Ayurveda that he didn't write more than 100 prescription in allopathic system, and he is vehemently against that system, that it can only be taken in a very big emergency with what it is unavoidable. So I happen to see cases being treated in such a scenario. So maybe that is also the conviction what I got. More than the know-how, I'm really appreciating the conviction what I got from my family. So what I'm trying to say is that, most of the clinical practices are focusing on treating musculoskeletal disorder, where the biochemical aspect of our medicines are never considered. A therapist can bring out changes, but the doctors are in a way naive and, not really needed to have a ascending aspect of knowledge within us. We can have this knowledge within few months, and afterwards, treating musculoskeletal disorder is not a big deal. So what I am trying to say is that we have to inspire people, like the doctor was mentioning just, how the doctor was taking up cases in COVID time, and how he was treating very difficult situations. So this is what we require at this point of time, and I'm really appreciating the young bloods, those who are involving in that, those who vehemently wanted to improve their quality of knowledge, and all these correspondence and cooperations, what might be evolving in future will be helpful for the whole of Ayurveda. So I would like to have some questions, so that, maybe some points what I might have missed, that you can emphasize and reciprocate with a question. Hello, can you hear me?
Yeah, Dr. Prashant, we can hear you. Yeah.
Right. So maybe, the rest of the time we can answer some question and have some discussion on.
Okay.
So shall I start? Ask Sandesh?
Yeah, please.
Namaste, Prashant ji.
Namaste.
It is nice to be with you. And okay, so we will start with multiple sclerosis. As we know, in modern science, they define I'm audible?
Yes. Please continue.
So what they define is autoimmune system destructing the myelin sheath in the nervous system, or in the nerves, or in the neurons. So this they define it as a multiple sclerosis. So on which aspect you see this disease from the Ayurvedic perspective? Whether you take it as a Snayugat Vat, Masgat Vat, or Mastiskajanya Vayu. So what is your view on this?
Yeah. Yeah, coming to that, first of all, from the very definition that the modern approach to that is wrong. It is not an autoimmune disease, because, there are many studies going on in that, aspect, because this disease is seen in certain places in high numbers, and that is not seen in certain places like in Japan or Mongolia. It's very rarely being seen. So such type of pattern is never followed. And there is no markers, unlike in rheumatoid arthritis and many other autoimmune diseases. Then also relation to the sex hormones, like women who are having MS, they are likely to have relapses after the after giving birth to this child. But during the pregnancy time, they are well protected. And also during menstruation cycle, the symptoms are flaring up. Such type of relation to sex hormones are not there in MS. And likewise, there are at least a dozen of strong reasons to say that it is not an autoimmune disease. So we are never treating by the way of autoimmune disease by suppressing the immune system or so. In fact, the immunosuppression therapies are really harmful for the patients. So it's just I wanted to mention something. So they give immune suppression medicine, including rituximab. This is given in cancer. What happens is when you suppress the immune system, they are likely to get infections. And it is known that MS is progressing from infection. So in a way, they are trying to suppress, but eventually it is paving the way for progression of the disease. What I treat is basically as a muscular vada disorder. And also, it is an immune-oriented, or immune-mediated disease. So you have to really have an eye on the immune system. In regulating the immune system, our medicines are much better and effective.
Okay, so your view on this in Ayurveda is Mastisthajanya Vayu.
You can say yes.
Okay, very good. So, what are your treatment approach, or based on what Ayurvedic Siddhanta you start the treatment? Like Shodhan Chikitsa, Shaman Chikitsa, like we'll speak on the Chikitsa aspect.
It's a Shamana Chikitsa, it's a Shamana Chikitsa, right.
So, no Panchkarma you are doing?
Pardon?
Shodhan Chikitsa you are not doing for this kind of patient?
It's not clear. Can you make it clear?
Shodhan, I am asking about Shodhan Chikitsa.
I'm very rarely I'm doing Shodhana Chikitsa. Maybe 1 in 15 patients or so only, whenever it is needed in that way, not basically for the neurological complaint. Whenever they need such a therapy, then only Shodhana Chikitsa is done. Otherwise, it is Shamana Chikitsa.
Okay, so is it possible to cure the MS if the patient comes in initial days or just immediately after the diagnosis, or we can only manage with our Ayurvedic treatment, or relapsing after our treatment stop, like that?
Yeah, I propose this treatment as a solution for MS, not like as a treatment of MS. So we have a clear approach to that a patient below the EDSS 3, it is a totally reversible condition. We cannot use the word curable. Curable in the sense, the whole lesion in the brain has to disappear. Then only, a total reversal is there. That means you can stop MS, you can improve the symptoms, and in future, you can protect it from further progression. So it is as good as being cured.
Okay.
And after the EDSS 3 onwards, you have to have a different approach.
Sorry, please mention that parameter, ED?
EDSS, that is an expanded disability status scale. But, I have created a better one based on the, doshas and the lesions. So we divide MS on a different scale, but EDSS is better, better to understand.
So can we go further deep? Which dosha will be more? It is of course Vayu, we know that. But in the due course of time, other dose also may involve in this. Then we
Yeah, I will do one thing. I will go into that and let us see if others are having questions also. I will come to you a little later because we are, the 45 minutes is about to finish. Maybe we'll go to the next question.
okay. So what type of medicine you are using more? Like a Bhutakalpana you are using more, or Rasaushadhi you are using?
I'm not using research. It's all herbal. It is purely herbal. All
Okay.
preparations are, yes.
So what generally I do is when I have a MS patient, actually I am not getting that much patient, hardly 3-4 patients I have got. And what I do is I give them Matra Basti with any Unmad Apasmar Gruta explained. Let it be Panchagavya group, Mahakalyana group. That's what I do. So what is your experience in Matra Basti of Gruta Kalpana?
Matra Basti, I have tried in the beginning times, but the outcome is not as good as the Shamana Chikilsa. What I am doing is, basically, Shirovasi is the main treatment. We treat the central nervous system by different means, and Shirovasi is the main one. Then the other treatments based on different types of disabilities, like a vision disturbance, or they have motor deficits or coordination defects, based on that, other treatments are being done. I mean, the other body treatments.
So Shirobasti you have mentioned, and yesterday I was looking your website when I got to know that you will be the speaker. So I was checking your website actually, and I was showing all the patients' photo with Shirobasti. So yesterday only I have decided about to ask about you Shirobasti. So which kind of oil or growth you use? Can you brief practical about on this Shirobasti in MS cases?
Can you make, one more time that question?
Okay, you will cover all the trick like that later.
Yeah, please repeat that question.
Shirobasti, what kind of Aushadha you are using in Shirobasti in majority of the cases, or how you will decide which to be used in which kind of patient?
Yeah, oil preparation is really very detailed in this. I have done different concentration of oils in Shirobasi. What I have seen is the best result is coming if you have a concentration of a 5 times to 6 times or more. That means a liter of oil to have an extract of 5 liters to 6 liters of extract per liter of oil, then that is having the best result. Second is I use fresh herbs than what is already mentioned in our classical text. So it is a little deviation from the classical text, but all the preparation of oil is the most dedicated one, I'll say. We take organic sesame seeds, we extract our own oil, and in that oil only that I prepare. So in this preparation, around 650 to 700 rupees will come for a liter of oil. And adding to that, when you have a 45 liters of oil being made in one go, that you need about 1,000 kilograms of fresh herbs. And when you take it out, instead of 45 liters, you may get about 36 or 37. That much kalka will be there by the end of it, So the oil preparation in Mrudubaga, that is the most tedious aspect of the whole thing.
So you are focusing more on Tela Kalpana.
Yes, for Shirovasi anyway, Taila Kalpana we need. So Tailas, of course.
So no classical like Mahanarayan Shilpala, you have your own preparation kind of thing.
If at all it is there, it is only for the body therapy, for the scalp, for the head. It's only with fresh herbs.
Okay, so do you have got any patient in which you find a lesion has getting shrunken, size is getting reduced, any kind of like that?
About 40% of patients I have seen, they have they show the chances of reduction or in the size of lesion or sometimes the number of lesions, but that is very unpredictable in whom it can happen. But most of the time it happens, or 90% it happens in the beginning stages of MS.
That is a good thing if we are seeing the reduction in the size in the radiological this part.
But reduction in lesion is only one thing, you know. After 3 to 4 years down the line, there is brain volume shrinkage is happening. So
Yes.
when a patient is coming, we are, it is mandatory to take a MRI here, in which a brain volume study is also done. So they use 5 parameters, including the CSF quantity is studied. So the more the CSF quantity is there, the larger will be the brain volume shrinkage. So they do the myelin, total myelin quantity, the brain parenchymal studies. So likewise, we are getting very vital data on brain volume. So after MS, after 5 years onwards, there is going to be a brain volume shrinkage, which is 10 times faster than that in the normal public or the normal individual. So it's not the lesion after 4 or 5 years. It is basically the brain volume shrinkage that is going to make far-reaching permanent damages in MS patients.
Okay, so have you? I think you must have heard about Panchamrut Loh Gugul. It is indicated in Mastishkagat Rog Adhikar in Basic Jatnaval. So have you used this? Actually, it is Ras Aushadhi. You already told that you are not using it, but your view on it?
I mean, so far, I know that in many ways you can approach a single disease. So since we are getting good result in this, basically, I'm not trying differently. But this is a good option that surely. And also recently, I'm not saying that totally we avoid, but Gandhaga, which is very much required for in MS, there is mitochondrial damage happens. So when I was having a talk with Terry Walls, a very famous doctor from US having MS, so she was telling that sulfur is really very effective. Why can't you prepare something with sulfur? So with the purified sulfur, I made one medicine, but I did not give for many. But about a half a dozen patients I have given by mentioning to them this contains sulfur, and that gave as a rasayana as well as in protecting from progression or relapses. It helps. So one can go on, trying different things. What is already known, like what you have just spoken.
Okay, thank you. So I think Skandeshji, others should have the opportunity to ask the question. I think Kishore Mahindarkarji has raised his hand.
Yeah, please.
Yes, Kishore.
Hello, good evening, sir. Yeah, good evening, sir.
Good evening.
Yeah. Sir, considering this a big disease in allopathy, can we simplify in Ayurveda with Samprapti Gatakas like Amshamsha Kalpana? What kind of dosha it is? What kind of dosha is affected? What is Shrotas involved and Shroto Dushti Prakar? Like we see 4, Shiragranti, Ati Pravrutti, Sangha, Vimargamana. If you can give a clear picture on this, we can manage the disease still more in a better way.
What I think is, there is anyway a Vata involvement in almost all patients, and also Pitta Vikriti is there. And as we see maybe it's a practical side of it, as we see in many times, in such type of situation, the Kapha dosha is mostly supplementing in this situation or trying to neutralize it. But if you see a kapha kshaya can be seen from different point of view. So in all the doshas are influenced in this disease. So that is the vital part of this disease. That is one reason where the youngsters are being affected. But I also have a very keen questions on it, and also experts who are in the theoretical aspect of Ayurveda. I wanted to put forth certain things to see how to, Samprapti Ghadakas are also sometimes contradicting also. So you cannot get into a very, for example, it is occurring in a cold country, and but warmth is worsening the situation in multiple sclerosis. If you give a Svedana, a person can die in a very extreme cases of Utos phenomenon. So that aspect, Vadaja Vigara and warmth is contradicting, and even warmth can blind a person temporarily or paralyze a person temporarily for hours to few days in MS. There has been, a couple of incidents. People died in a bathtub while taking warm, while using warm water. So that's what I'm saying. This is a disease what we, experts in theoretical Ayurveda has to come up and to solve certain puzzles in this disease. So beyond this limit, I'm not going into that. In fact, we have spoken, but I'm not really 100% sure about it. So I leave that aspect to the theoretical Ayurveda experts.
Okay, sir. Thank you. Can you just give us an outline that once a patient diagnosed with MS coming to your OPD, how can we screen it and how to initiate the treatment for this? Very practically.
Screening, is very easy. MRI is the main one. CSF studies, even without that also, 40% of MS patients in India. The MS in India is quite different than what we see elsewhere in the world, because MS in India tend to progress very fast. I have done 30 MS patient studies from the Western as well as from the Indian MS patients. MS patients in India do have involvement of vision in the initial attacks up to about 40%, but wherein in European counterpart it is only 10%. And the walking difficulty sets in as early as 3.5 years in Indian MS, whereas in European MS it is 5.5 to 6 years time. So a youngster who is coming with a vision disturbance, with a typical motor sign, even without MRI, you can more or less point out the complaint. MRI is almost 95% confirmatory for MS. So I don't think this is a very difficult disease to confirm or diagnose.
No. To initiate the treatment, sir. Outline to initiate treatment. What to be given, so that we can assure the patient that you will be somewhat better after 3 months.
I'm not, here. My main medicine in for intake of medicine is kashaya. I never give already made kashaya to any patients. So we have either churnas are given. That is all made most of the time for the patient. A few medicines are there. What is best for optic neuritis or a motor deficit. A few are there, but about 80% of the time it is making individualized medicine, and everybody has to take kashaya. That is from the medicine point of view. The others are the others what are required are medicine what we prepare in the pharmacy for the treatment. And in this treatment also, we have, have new ways of few treatment. For example, we do Shirodhara with the pure extract. And I have seen Bringaraja extract, and it has to be used within 2 hours. When you do a Shirodhara with that, it is very, very good for optic neuritis. And you see within a couple of days or 3 days time, they recover. But it also have a lot of contraindications also. And after looking after all those things, considering all aspect, this is a very potent therapy. So likewise, a few therapies we have put forth, and also the Tugakshiri we are using instead of Nyavara. So a few therapies are being made only for MS and for the psychological disturbances also. So within the framework of Ayurveda, that newer things have been put forth in the treatment of MS.
Okay, sir. Sir, last, sir, I'll just close off. Sir, what according to you, if not autoimmune disease, what is causing this multiple sclerosis? And second, sir, any specific drug of choice so that it is available everywhere, we can use or start in multiple sclerosis. If not, only specific you do, how we can connect with you, sir? How some patients may not travel all the way from, I stay in Hyderabad. From Hyderabad, they may not be able to travel. So, can you please put a light on this? And thank you, sir. Thank you in advance.
Yeah, thanks for the question. You see, it is better to always give a treatment where the results are more assured. So I normally suggest all the MS patients to have an inpatient therapy. Sometimes those who are having severe financial problems or other difficulties, that I rarely prescribe them medicines. And patients are also willing to come for shorter duration of time. Then I am not accepting anybody less than 60 days. So once you follow this rigorous method only, you can find a result. There is no easy going in MS. Most of the time is a very important factor. Once you started to have severe walking difficulties with foot drop, there is no reversal. So once you are diagnosed, within 2 to 3 years, it has to be controlled. It has from relapses or from brain volume shrinkage. So you have to do a very effective treatment, and that is by inpatient therapy. That is my advice.
Yeah, I think what Dr. Kishorji is seeking is, can you please name a few Shastrokta or classical medicine which can be available throughout the India? I think Kishorji is asking about that.
I wanted to tell you, coming to that, I'm not using classical preparations. What I use in the making of herbal oils, or like I use the Deshapushpa I am using very much. Then Brahmi I am using, Mandukaparni I am using. Then there are other few herbs that are not very well known in the northern aspect. What is more available here in Kerala are also being in use. So these are the main thing. And in Anishta, Deshapushpa is very, very good for balancing the immune system. But the problem is that when I try to dry up this medicine and make a powder, then it is not effective. So when we move to making Arishtas or Grida, Deshapushpa, in both these aspects are more effective in protecting the immune system than drying the medicine and making a powder. So basically, classical medicines somehow, again, when you move for Bela Mula alone to make Bela Taila. So you have a lot of restrictions that you don't get quality medicines. So you have to, I will say that, after going through the pharmacopoeia, or after understanding the different single drug medicines also, you can incorporate many medicines. So my usage of classical medicines are rare. Again, I want to tell, Dhanyandaram and Belatailam I use for the body. Otherwise, there are no classical medicine that I use.
Any paper has been published by you, sir? You have told you have 30 case study. I think you have mentioned somewhere. Anything that we can read or
Yeah.
other doctor can read and
I
get.
did not. So far, I did not look into that much. But with this Dr. Skantesh, I was telling, I think one or two case studies have been done. So, but we are in talk for a pilot study comprising about 50 patients, involving neurologists from abroad. But the main stumbling block is the funding. The last this 50 patient pilot study may require about 6 to 6.5 crore rupees, and that is the main issue with us, because we have to study a protocol rather than a single medicine. So it's a very time consuming as well as financial encumbrance is there.
Okay, sir. Thank you. I think Skandeshji, anybody else want to ask question? Please, they may ask.
Any participants remaining who are interested to ask any questions are open.
Sujata madam is there? Skandeshji?
Yeah, I think
I'm here.
Sujata.
I'm here.
Sujata, yeah, please introduce yourself, and madam, you can ask.
Hello, thanks for the presentation. I'm a sociologist who works on sociology of medicine. I was just wondering what the total cost of this treatment would be, roughly, average cost.
Like, this is not the area to tell that, but I can tell you for 60 days, including all medications, etc. I think per day, the expenses will come about 5,900 or nearly 6,000 rupees per day. That will be the expense.
And this requires one-on-one monitoring on an everyday basis.
Exactly, yes.
The one thing you mentioned was very interesting about the regional and national differences in symptoms and even in the incidence of this condition. You mentioned it doesn't happen in Japan and Mongolia. It happens more in European and countries in North America, if I understood correctly.
Yeah.
So, do you think regional climatic factors are playing a role, or it's that something else? That, I mean, just some thoughts.
Yeah, they think that farther from the equator, the incidences are high, but incidentally, from 2010 onwards, the number of cases in India is fast escalating, especially after the COVID. So, of course, in Scandinavian countries, it is more. In Canada, is a maximum, and the colder, parts of the US is also having higher number of MS patients, and Indians who are migrating to these countries are having higher chances of getting it. So it's really, and also genetic aspects are more prominent in Indian type of multiple sclerosis. I have treated 3 sisters having MS, 2 sisters having MS. So, and brothers who are having MS, and right now they are here. So the genetic aspect is more following in Indian type of multiple sclerosis.
That's very interesting. Can you call this multiple sclerosis? Is it a spectrum of ailments or is it one? Second is, how did you correlate, how did you find out the Ayurvedic name? What is the Ayurvedic name for this condition? And how you made the correlation with the Ayurvedic treatment? How did you identify the Ayurvedic treatment for this condition? Will be very interesting to know.
What is your first part of the question? Can you repeat it? What is the first part of the question?
One second. I actually wanted to know this, the second part, where how you correlated the symptoms of multiple sclerosis with the Ayurvedic approach. You said you chose certain treatment methods. You said it is mastika vayu or something. You adopted that. So how did you make that connection? Did you go and study the text? Did you consult with people, or it just emerged by thinking about it?
Yeah, it appears that, I'm not much into the Ayurvedic fundamentals, but I'm very much rigorously into the fundamental aspects of Ayurveda. Apart from the diagnosis part of it, it's totally depending on Ayurvedic fundamentals. So, but my way of analyzing and understanding the Ayurvedic fundamentals are a bit difficult from what I have learned from the university or from the college. Ayurvedic fundamentals has to be really revisited and rewritten. That we make a mistake that we correlate the Ayurvedic fundamentals with the allopathic system and its evolution or its kind of studies. But the Ayurvedic system is totally different. It considers the human system as a system far from equilibrium. So we have a different approach in understanding systems far from equilibrium. So non-equilibrium structures are something what is going to be studied in the future a lot. And we now know that the life or living system is a system far from equilibrium. We are much farther ahead in that. Like in Kriyakala, right now we are trying to write a small paper on that. So we have we say the chayo vriddhi sudam neva pradvesho vriddhi hedishu viparita gunecha. This is one of the fundamental aspects of the feedback mechanism. What the general computer was created in 1940s. Von Neumann was explaining about this type of feedback mechanism, what we have written 2000 years. And also Kopastu Unmarga Gamita. So in there you see that bifurcation points. So what is told about the bifurcation points? And now only they think that this can be used in living systems also. But we have used 2000 years back. So what I feel that the way how we use Vada or Pitta or Kapha, it's all about understanding the undivided whole with a lot of interconnectedness where systems are interconnected. The understanding of that. So I think it's really a different area of investigation, research, and study. And of course, a lot of brainstorming.
Thank you so much, Doctor. As people outside Ayurveda, as someone who's interested, how younger generation is innovating, drawing on the principles, but you are taking that knowledge further in treating rare cases. How much you derive from the text and from your college learning, and where you have to apply your own yukti. How is that is what I was trying to understand. You said correctly that the texts are not always, you can't rely on their classification, but you are taking some understanding from the text and your clinical experience, observation, etc. So in multiple sclerosis, how did you make that combination?
Yeah, I mean, fundamentally, I will never say that I took up only a few aspects, but I again wanted to emphasize that Tridosha principle is, one of the principle why Ayurveda is having, substantially, or, living all these centuries of, difficulties. Ayurvedic fundamental principles of Tridosha is so finely written. So I will never say that I took up certain aspect from that. It is fully from Ayurvedic aspect, but it gives a lot of flexibility and plasticity in our thoughts and action. So only that I took up. Then about naming the disease and like that, the Ayurveda acharyas have told you need not have to name a disease. A new disease is coming. The fundamental principles only vary in that you use that. So we have, we have all the alphabets, and we can write new poems. The alphabets are the same, but only the syntax changes. Once you know about how to use it, you can include future diseases also. That is an in-depth thing in this fundamental principle. That is its greatness also.
Thank you so much. That made a lot of things very clear. That we should not be breaking our heads on naming. But the ICD is insisting that every disease has to be named and classified, the international classification of diseases. That's how allopathy progresses. Do you think Ayurvedic approach will be can be fitted into the ICD type? I think some such attempt is also being made that you should name every disease and classify it.
I'm not saying that we don't call it by a name, but it is multiple sclerosis. What it is known in the society should be the name. We don't have to have a Sanskrit name for that. So that is one point I want to tell. Then can you elaborate what is ICD? What is the full form of it?
It is International Classification of Diseases, which they have for allopathy. And we are told that they want to bring it for other systems, alternative systems also, putting the similar model.
I would like to interpret it, Madam Sujata, Madam. Can I?
Please, yes, please.
I think the code has been published in US. I have one student of US in my hospital for internship. She was saying that in US we have a code of WHO, like that we have to write, then people will accept. So I think the same code has been published in USA by WHO or FDA, I don't know, but it is there in USA. Same, what you are talking about, international classification of disease.
Yes, they have codes. Every disease has a name and a code. So even certification of death is based on that code. So it seems they are trying to do some such thing for Ayurveda also. So I thought, from what I understood earlier, Dr. Patel's presentation and Dr. Raghavan's presentation is that we should not worry too much about exactly naming the disease, but it is the principles that you are of that Vata, Pitta, Kapha that you are focusing on. But this was very helpful. Thank you so much.
Thank you. Thank you.
I think Dr. Kiranji has some question. You may please ask, Madam.
Namaste, sir. I'm myself Kiran. Sir, any particular diet for MS patient or any things that should not be taken or that has to be taken? Could you please elaborate?
Diet is really very important for that, and most of the MS patients follow different type of diet, like Terivol's protocol or Swang diet. Like many diet is being followed for MS, but we propose Ayurvedic dietary. So I think that is much superior than that. we have an elaborate app for diet as well as for the yoga for multiple sclerosis. And in this, we have evaluated about 450 different types of dietetic, food stuff in that, and food during relapses or food during infection or urinary tract infection, what need to be taken, what need to be avoided, like that elaborate classification we have done. So that's a novel one. What I wanted to tell you is that, it's not only on MS. You youngsters have to focus on deriving new treatment methodologies, or focusing more on disease, on specialities, and to find solution for that. And it is possible for 40% of chronic progressive disease that and Ayurveda is having an answer to that. So of course, again, coming back to the diet is very important, not only for MS. A good diet is required for the success of the whole treatment process.
Thank you, sir. Any specific things which should be avoided, anything like that?
Basically, we recommend a vegetarian diet, and based on that, and in gluten-free diet is recommended. It's not, we are not against wheat, but wheat, after a lot of modifications in its in the last centuries, or in the last few decades, made it, maybe that is the reason. The original wheat, like Kapli wheat, that is not making big problems. What is available in the north, the original wheat form. So gluten free diet is recommended. Then some are following a dairy free diet also. That we also recommend in certain constitution, like in the Kapha constitution, try to avoid.
So, in your presentation, when you are beginning, you made a very important statement, a very imperative statement, that the progress of Ayurveda depends on how we take up the specialty practices. So it's a very important statement that you have given. So how do you actually assess your own expertise that is being evolved when, since from a traditional lineage, and to comprehend certain kind of, maybe some knowledge regarding or this kind of very specific kind of understanding and knowledge. So how you assess in a traditional lineage you to treat this kind of advanced disease or specialty practice?
In the traditional way means, it's not really.
Sorry, participants, please be muted. Hello.
Hello. Okay.
Yeah.
So, in the tradition means, I'm not telling, the tradition is very adamant, orthodox, and deterministic. No, not like that, So, we, it's purely based on the fundamentals of Ayurveda. Then evolve, we have the tools with us. Everything is with us. So the only thing is that, I think the motivation, willingness is required. I'll say that is required, and to move out of the, what you say, to take up newer goals and newer pathways. It is really, really possible. We have everything in Ayurveda. I'll say that you don't need anything new to be brought in. So this is required, rather than being gone into a scattered field of generalization. You have to take up specialities. I have to mention Sridharium is very successful. They treat eye disorders. So their name is very well known and inside India as well as outside India. Why? It's a specialty center. The same disorder might be managed in other general clinics. So once you have a specialty, you are focused very, within a few years. Then you don't have to look at for bigger marketing or such other difficulties will not be there.
Thank you, Dr. Prashant, for your insightful response.
Can I ask a question? Yeah, this is Onni Krishnan. I missed the first part of your presentation, but I have 3 questions. One is, Ayurveda has classified diseases into Sadhya, Kashta Sadhya, or Yapya Asadhya. So what is, in your experience, what do you classify this condition as?
MS is a Kashtasadhya disease, So you can, like you say, that certain Upadravas are there or certain allied diseases are there. For example, some are having other immune-related conditions like, Crohn's disease or even a mild eczema also can make it difficult to control. So it's a Kashtasadhya disease. The patient has to follow rules in their diet as well as in their daily practices. And I'll say that medicine, everything, you have to make it very specifically. It's a difficult to treat disease. And it is, we initially, I was telling until EDSS, if the other aspects are fine, we can, stop the disease, we can stop the progression, we can stop the MRI changes in future, and the disease can altogether be stopped. So wherever there is no, absolute cure is not possible, you also have to consider that it is a Kashtasadhya disease. So that is my view on it. And once it progresses beyond EDSS 5, or you have, bigger confluent lesions in thalamus or basal ganglia, or you have cognitive deficits, which is very severe, where you have brain volume shrinkage to beyond a certain limit, then it is what you say, yapya, or you have to continuously treat, but there is chances that it still can progress. So it comes in Kashtasadhya and Asadhya, it is overlapping.
Yeah, my second question is, what is, how long have you been able to sustain the results? I mean, who probably your oldest patient?
My oldest patient is now 23 years. I have treated in around 1999 at that time in my family clinic. He's an American Jew, and since that time, I have patients who are leading normal life. So till EDSS 3, I can tell where there are no confluent lesions, where there are no lesions in vital areas, there are no severe symptoms of MS, like incontinence, cognitive deficits, or irreversible vision disturbances. Till that time, you can reverse most of the diseases in the beginning stage of MS. And in that stage, once you treat, it can be stopped.
Okay, the last
so
question.
I'm telling all the patients who are coming over here, their value of money is valuable, and my time is also valuable. I'll tell them the first 15 to 21 days, if you don't have a change, then don't stay here. So this is very well written in our in the center itself that everybody can read. So this is our what is ceiling time, and within that time changes has to happen.
Just one more question. Sorry for taking so much of your time, but the last question is, what is the basic Chikitsa Sutra that presentation? Thank you.
I'll say that, I will not concentrate just on Koshta, or that might be more on a reductionistic point of view. I see the whole system, in that Koshta might be important. Koshta has to be seen in relation to, your mental faculty, related to your fatigue, related to many, many aspects. It is related. Then only the meaning of Koshta is complete. So I'll say the whole system is important. And, with the doshic variations, we are trying to understand the system's variation. And from a system point of view, the treatment is given not particularly on any system or an organ or like that. I never divide. I think any time when you divide the body, the Ayurvedic fundamentals are lost in that. A division is never an aspect of Ayurveda. Ayurveda sees the system as a whole. Once you divide that, the system fails.
That's clear. Just in Kashtasadhya diseases, we usually have a Chikitsa Sutra, like if it is Meha or some Mehino Balina Kulya Adu Vamana Rechane. I mean, there are Chikitsa Sutras, so I just wanted to know whether you have developed some protocol like that. Anyway, thank you very much. Very, very, very interesting. Thank you.
Thank you. Thank you. This part of the question I did not understand, but anyway, maybe later on
what
we can
I
discuss.
meant was, for every disease, usually there is a Chikitsa Sutra, and that might be focused on, like in Meha it is Kleda, in maybe in certain other diseases, in Jara it's Agni, in Raktabeta it's Raktatatu and Pitta. So have you identified any specific, I mean, of course, we see everything as systems, but maybe I'm also becoming a bit reductionistic here, because there is a lot of cost and the gut-brain axis and all that. So, I mean, are you focusing on any particular focal area in Ayurveda? That's my question. Anyway, thank you.
Actually, you don't find MS as just a central nervous system disease. It do have relation to the koshta. It do have relation to the hormonal function. Likewise, and also psychoneurological axis is very strong here. Mood swings and depressions are one of the major problems we are facing here. So it's never it's a multi-system disorder where the main receptacle is in the brain, like that you can say that. So I don't have a single takeaway answer for this, as you have mentioned. That unfortunately I don't have.
Yeah, that's very clear. Thank you. Thank you.
Yeah. Hello, doctor.
Yeah.
Very interesting discussions happening. I just want to add on, like, based on the discussions happen now, like about the Kashtasadhya diseases. Can we, like, what is your take on generalized rare diseases or Kashtasadhya rogas? When you get a patient in a pre-symptomatic stage or before the Samprapti established as it a Ruba or Pura Ruba, if you get a patient, what is your take, like how Ayurveda can actually work on the patient, and what is your process and thought process on the same, like whether it's treatable or just before establishing, how would you feel if you get a patient?
Just before establishing, I would say that if most of the time the presenting problems are mild numbness or sensitivity problems, sometimes the presenting problem is a vision disturbance. So when there is no diagnosis possible with the MRI, so you have a very rarely you get a patient who come to your clinical practice without a proper diagnosis. So that was, we didn't have such instances where they come for a treatment. But they when a vision disturbance is there, it can be either optic neuritis isolated or in relation to multiple sclerosis. Some are coming, very rarely they are coming. But most of the time, a youngster is having a vision disturbance and it is subsiding with a corticosteroid. He will not take care about it until and unless a second attack is coming with other difficulties. Then only they approach a physician or a doctor. So that's the situation.
My question was a little different. Like I was taking, based on your treatment experience, taking out of multiple sclerosis, there are several diseases which you can identify, which can be Kashtasadhya. It's not multiple sclerosis, but diseases similar to multiple sclerosis, like any neurodegenerative disorders or genetic disorders or anything of that sort, where you have a pre-symptomatic patient. So according to your treatment experience using Ayurveda, for those generalized diseases, what do you think Ayurveda can do in that scenario?
This is the whole thing I wanted to tell you, that we have to take up different systemic diseases that are not having a solution in Western medicine. The number of diseases are so high. Like in degenerative neurological diseases, there are no answers to that. So we have to come into that and to take up with a research point of view, with an investigation point of view. So if this is the question, what you are tabling, I want to tell you, this approach can be utilized in treating or setting up other specialities, and surely one can do. Recently, before Corona time, I had a small session with a neurologist from Manchester University. He's from Jaipur. He's a senior neurologist there. He is in the panel of UK doctors. The aim of that panel is that they are thinking in the next 20 years, the number of Alzheimer's and dementia-like disorders will be, doubling up within that time. So what is the solution? So these are all happening around us where answers are required. So if we, if we make a change in our already existing knowledge, we can take up, such type of problems. Not only on MS. My talk to you for the last 1 hour is basically that you youngsters have to take up newer specialities and pitch in deeper into that disorder, and surely there is a lot of solution out there.
So thank you, Dr. Prashant. Because of time constraint, we cannot actually, there are many questions still. So I think we can get back on it's like a continuous session that we are planning, like with different speakers. Maybe we can invite Dr. Prashant again if based on his comfortable timing also further. So I think we have noted down the question. So we will get back to you with his response maybe next session. So I quickly invite Dr. Rajnikant ji to
Dr.
summarize the
Kandesh,
session with
can I make just a comment?
Wherever my involvement is required, please be free to inform me on that.
Thank you, Dr. Prashant. Yeah.
Okay, so it was the nice presentation by Dr. Prashant sir, and important point he has covered in MS was geographical variation he has found in Indian patient or some Western patient, maybe Germany. That is the important thing. What Ayurveda says about Desh Kal Bal. Okay, and important point is that he prepared the self medicine. That is the where Ayurveda lacking nowadays. We don't get good results with what medicine available in the market, and Prashant sir is preparing his own medicine for that patient. That is the good thing, and that may be the reason why sir is getting very good results, and we may not get the results if we treat same patient in our hospital. So that was the good talk given by Dr. Prashant sir. I would share my interpretation of MS on this. It is my personal view. There may be some very differentiation in view of other doctors. So I think somewhere it is written that Mashtishka is prepared of Med Dhatu, or whatever the grey matter or white matter or cerebrum, cerebellum, central nervous system part which is available inside the skull. It is made up of normal Med Dhatu. So maybe treatment focusing on the Med Dhatu will give the best results in MS and other neurodegenerative disease. So this is just my personal opinion. We may work on this. And when we see multiple sclerosis from the modern science perspective, what they say is it is autoimmune disease. But today I came to know with Dr. Prashant sir said there are there may be some other reasons apart from this autoimmune disease. So we will study on that also. But let's assume that if it is a autoimmune disease only, then they describe this as the destruction of the myelin sheath. The autoimmunity activated, and they are destructing myelin sheath of the neurons in the whole nervous system, particularly the central nervous system. More particularly to the brain tissue, cerebellum, what Prashant sir was talking about. So what I understood is myelin sheath or neurons covering is prepared of phospholipid. That's what modern science says. And we found phospholipid naturally in plenty of numbers in cow ghee. And we also see that treatment of Unmada and Apasmara, which is straight away related to the nervous system related disease, we find the majority of the medicine has been given in Gruta Kalpana. Unmad, Apasmar, all the Panchgavya ghee, Mahapaichachika Grut, all the Gruta has been given, and in Acharya has given Purana Gruta, Prapurana Gruta, all the ghee explanation in Unmad Apasmar Chikitsa only. So that might be the reason that the myelin sheath is prepared of phospholipid, and that is getting destructed in the MS due to the autoimmune mechanism, and cow ghee has naturally available phospholipid in it. So what I do in my clinical practice is whenever the patient comes to me, which has the central nervous system or peripheral nervous system involvement, I use maximum Gruta Kalpana in those patients, and I find best results in the majority of the cases. There may be some cases where we fail, but majority of the cases in neurodegenerative cases, or where there is a nerve involvement is there or neuron involvement is there, we find best result when we use a Gruta Kalpana, because we are providing a phospholipid directly, and we also have a shloka to support this statement that sarvada sarva bhavanam samanyam buddhi karanam. It is simple. Person is losing blood in the accident, then we supply blood from outside. It is the same way Med Dhatu or the myelin sheath is getting damaged. So we are providing the material which myelin sheath is prepared of from outside. Through ghee, Gruta Kalpana we are providing. And in beginning only I said to Dr. Prashant sir, what I use is Mahakalyana Grutam Matra Basti we give. And I think Dr. Unnikrishnan sir has pointed out very well blood-brain axis in this case. So when we give Matra Basti to the patients in this type of disease with a Gruta Kalpana, maybe Panchgavya Ghee, Mahapanchgavya, Paichachik, Mahakalyana, so we see the results. So this is my main input in this multiple sclerosis use of Bhuta Kalpana, because we have some statement to support this. Sarvada Sarva Bhavanam Samanya Vruddhi Karanam. Then phospholipid, it is made up of myelin sheath, it is getting destructed, so we provide a phospholipid in the form of cow ghee from outside. So this will increase based on the this Sarvada Sarva Bhavanam Samanya Vruddhi Karanam Siddhanta. And when we see the Vayu Prakopa Lakshana, Sankocha is the first thing which Acharya has described. So Sankocha in this, what we can say is shrinking or the reduced in the size of the brain tissue or brain neurons reduced in the size of anything, that is Sankocha. So I think Vayu is the main culprit in this disease. And when we see the neuron signals, Acharya Charaka in Sutrasthana has explained Vayu has two main quality. One is Anavasthitva and Amurta Sangat. Anavasthitva means Vayu is not stable at one point. At 1 second, Vayu is here, and in another microsecond of that same second, it will be traveling to another place. So that is Vayu, Anavasthit. It is not stable at one place. Then another big quality of Vayu is Amurta Sangat. We cannot see the Vayu. In Pitta and Kapha, we may have different like that. So, Vayu is Amurta Sangat and Anavasthitva. That is nothing but the neuron signal. The neuron signal is traveling throughout the body and it is not stable and we cannot see. So, neuron signals or the signals, electrical signals passing through the neurons can be compared with the Anavasthitva and Amurta Sangat quality of the Vayu. So the Vayu Prakopa first Lakshana is Sankocha. So there is a Sankocha in all the neurodegenerative disorder, including this MS disorder. So this was my input and it's my personal view. And thank you very much, Dr. Prashantji, for sharing his expertise and his experience on this subject. And I would like to have more session with Dr. Prashantji to get more knowledge in deeper aspect. Thank you.
Yeah, I think by that words we can conclude today's session of with Dr. Prashant and chaired by Dr. Rajnikant. So we had an active participation from all the participants, and this actually made this forum to be more based on dialogues rather than a kind of an session. So thank you, Speaker Dr. Prashant sir and session chair Dr. Rajnikant Patil. And we thank as part of Forum for Medical Pluralism and Pluriverse to all participants to make this successful. And we will be conducting these kind of sessions monthly twice. So we invite all your participation in actually, bringing down more insights, more better policy draft, and more part of insights in the newer way of seeing things also. So thank you all.